Hi, guys and girls. Hi, all.
Hello.
I haven't seen you in ages, Peggy. How you doing?
Hanging in there. How are you doing?
Same. My my 1-year-old had to get tested for COVID on Friday. It has been a week, but we finally got the test results this morning, and he was negative, thankfully.
Nice. Oh, I'm so glad.
Yeah, it makes sense. His fever went away yesterday, but both boys have been home. Full stop. No childcare since last Thursday.
Great.
Do you remember those early years?
Oh, only too well. And my boys were only a year apart.
Oh.
But fortunately, we didn't have COVID. Somebody made the joke one day that if I'd had to go to work in an ambulance, I would have gone just to go.
Well, and I haven't been going into the Sunset Building waiting these test results.
Oh,
so
sure. Yeah.
I have been home since last Wednesday because he got sick on Thursday. So yeah, I can't wait. I'm gonna go into an office tomorrow. Not here screaming. No diapers. No 3,000 snacks.
And when they're sick, they just want mommy time.
It's both.
Oh, is it?
Yeah, he has done stay-at-home parenting with both of our kids for over a year. And when I started this job, he was full-time stay-at-home parent. And so it depends. But yeah, both of them run to dad or mom when they're hurt.
Oh, that's good. Well, awesome.
It is good.
I was all excited. My little 5-year-old grandson just lost his first tooth. So I made my son send me a picture. Send me a picture.
I am trying to get this to, okay, good. It's recording. We had a problem with recording at last month's meeting that I'll share with you all, but basically it didn't record. Very frustrating. Okay, I see a lot of people joining. Good to see you all. Christina, it's the first time we get you via Zoom. This is so exciting. I'm glad your laptop is fixed.
I had to bring it in for security reasons. Here at the shop, I don't have any cameras on my monitor here at the shop. So I had to bring my laptop from home in order to do this. So there is no cameras on my computer because it's not a good thing to show all my security. I'm in my office. So anyway, stop
Makes
seeking.
sense. Makes sense. Okay, well, I will give one more minute for people to join before I officially start. But it's good to see all of your faces. Any updates from this group that are personal that anybody wants to share? Good news? I know, we're still on quarantine. I'm surviving. I have a house and I have food, so that is great news.
There's no smoke.
No smoke.
Yeah. I have some news.
Yeah, Flip, go for it.
So in October, we're going to be working with Willamette River Keepers and Parks and Rec. And so we're going to have cleanup at Pioneer Park on October 8th and the BMX Park October 16th. And those have been really successful. We have lots of people come, but also the homeless people themselves also are participants. Not everybody, of course, but enough that it really feels like we're working together.
Can you repeat that?
Yeah, I just got it, Jan, just like 20 minutes ago. It's October 8th. We're going to be at Pioneer Park. October 16, we're going to be at BMX. And then River Keepers for people that have canoes and rafts and kayaks. On October 3, there's going to be where they clean up trash on the water. I mean, like they use water access to pick up trash.
Do you have to be a member of River Keepers
Nope.
to join in? So if you have
I'll be sending out an email to everybody, and then you can sign up online at River Keepers, and that's for liability. Yeah.
And Flip, last time there were enough volunteers and due to COVID concerns, they didn't want to cast a wide net for too many people. Is
Yeah.
that not the case this time? Are you inviting volunteers this time?
We're inviting people, but how that plays out remains to be seen because they just cut it off when the limit gets met for those
Got it.
same reasons. But what we try to do is just spread ourselves out in multiple groups. So we'll find out.
Well, thank you. I like
Mhm.
starting on some good news. I'll
Yeah.
go ahead and get the meeting officially started and go ahead and share my screen here with you all. Give me just a second. Cancel that. Okay, slideshow. All right, is this showing up for everybody okay?
Mhm.
Thank you. So we're here for our September board meeting. And just some Zoom housekeeping. I just heard someone on the keys there. You're muted when you join, but you do have the freedom to unmute yourself. Please stay muted unless you are making a comment or you have a question, just so we don't get feedback in the background. You can also share your video or go ahead and not share it. For those of you from the public, if you want to make a public comment, there'll be a time for that, and go ahead in the chat, say your name and the topic that you want to make a comment on. And I'll go ahead and look and see if there's anybody on the phone as well and give people who've called in the opportunity to comment. Same goes if you have a question, go ahead and type into the chat and it'll be sent to me. So just an overview, I will give a brief overview of the meeting, talk about the agreements and the culture that we have set here as a group, allow for some public comment up to 10 minutes. Alita is calling me. If someone else might be able to reach out to her and text her, that would be helpful. Is there anybody in the group who has Alita's phone number who could give her a quick call while I go over this? George, I'm thinking of you.
Yeah, I can do it.
Thank you. Then we will vote to approve the minutes, and we have some logistical updates, and then the presentation from our last work group. And at the end, our equity consultant, Dr. Aguilar, will join us to introduce herself and go over the results of the self-assessment that this board did in the past week. So for those of you wanting to make a public comment, just a reminder how to do that. I'm going to give a brief overview of where we are in the process. George, are you unmuted still? I think I heard something. Yeah, there we go. And I will circle back to public comment time after I go over the overview of where we are and our culture. So you guys came up with all of these agreements. Of course, we are remote, so I can't send food to everyone. I apologize. But inclusivity, humor, respect, honesty, curiosity, transparency, kindness, concise communication, remaining open-minded. Those are just some of the agreements that you all voiced the first time you met. So I want to be sure to remind you all of those and anybody who's attending to do a public comment. And where are we? Many of you are familiar with where we are, but for those who are just joining us, we are meeting for our, let's see, 1, 2, 3, 4, 5, 6, 7th meeting today. After 3 meetings, we had to pause because of COVID for 4 months. We reconvened in June, and now this board is meeting for the 7th time. So we're still early on in the process, but tonight we will have the last presentation from our work groups. And the goal is that at our next month's meeting in October, you all will have enough information from our data and our research to prioritize 3 to 4 areas based on the guidance and the bylaws that have driven this whole process. And then this fall in November and December and going forward into the future, we will engage the community on those 3 to 4 priority areas and really get feedback from as many people in this area who would like to contribute to this process. Okay, I'm going to go ahead and check out our chat here and see if, oops, sorry, go back. I'm going to stop sharing for a second and see if anyone's giving me a signal that they would like to make a public comment. I don't see anyone in the chat who has said that they would like to comment. Let me look if we have anyone on the phone. I want to make sure to give an opportunity. I do not see anyone who has called in on the phone. So hearing no takers for public comment, I am going to move on. Last chance, going once, going twice. Okay, no public comment at today's meeting. You know what, let me make sure we have Paula on the line and that she can hear everything. Paula, I see that you're here. Is your audio okay before I move forward?
Yes, I can hear you, and I just wanted to make sure you're recording it.
I am. Thank you for the reminder.
Okay,
I see
thank
my
you.
little recording button up top.
Okay, thank you. I can hear fine.
Thanks. Paula is our wonderful dedicated note taker with the Benton County Health Department. Okay, some logistics. We'll vote to approve the minutes and I will take roll as we do that approval. All right. Hopefully everybody had an opportunity to review them. I sent them out on Friday. Okay, so go ahead and unmute yourself as I call your name and say yay or nay and present. Flip Anderson. Oh, you know what? Before we do this, I apologize. I always forget to be a stickler for procedure. We need a motion to approve the minutes and have it seconded. Do I have a motion?
So moved, Carol.
Thank you, Carol.
I second that. This is Nicole.
Thank you, Nikki, for seconding. All those in favor, Flip Anderson, go ahead.
I'm present and I vote yes to approve the minutes.
Thank you. Lennox.
Aye.
Thank you. Zan.
Abstain. I was not here.
Thank you, but you are here for this meeting. Appreciate it. Catherine. Let me double check that we have Catherine here. Catherine Bisco, are you with us? I do not see her on the line yet. Okay, Mark, Catherine not here. Carol.
Aye.
Thank you. Bruce. Let's see if I see Bruce here. I do not. Okay, Bruce is not here. Brian. I do not see Brian, although I know he might not be here for emergency reasons. Anita. Do you vote to approve the minutes?
I do, although I missed that meeting, I certainly reviewed the notes, however.
Okay, then I think you abstain if you were not present. Thank you. Joel?
Aye.
Thank you. George?
I am
think you were-
here. I'm talking to Alita. We're getting her a link. And the minutes are fine.
Okay, thank you.
Yeah.
Barbara? Boy, I swear I sent the link out. I'm having a tough time tonight. Barbara, not here. Alita, I know she's trying to join, so let's give her a minute. Nikki?
Aye.
Christina? I don't think you were here last month, so I think you have to abstain.
Abstain.
Thank you, but you're here this month. Charles?
Aye.
Thank you. Peggy?
Present and abstaining.
Thank you. Jim?
Present and vote yes.
Thank you. Andrea?
Yes.
Thank you. Jan?
I'm present.
Reese?
Present and I vote yes.
Thank you. Linda?
Present, abstaining.
Thank you. Alita, I'm glad you could join us. We are voting to approve the minutes from last month. Do you vote yay or nay?
Yay.
Thank you. Alita is present. All right, the minutes pass. Thank you all very much. I'm glad you were able to join, Alita. Okay, let me go ahead and share my screen and we will get back to some logistics. The videos of the past meetings, June and July should be posted very soon. Our administrative personnel are trying to figure out how to host a link to it without actually having to host the full 2-hour video. Once that's resolved, they'll be posted on the Hope website. The August video is never going to be available, and I sincerely apologize for that. It said it was recording. We had a glitch with Zoom, and I worked with CSC's IT department to try to recover the video. It is not recoverable. We don't have the video from last month's meeting. My sincere apologies. That's why Paula reminded me to double check that this one is recording, and it is. We are going to entertain the idea of changing the meeting schedule for November and December. And I just realized this yesterday and was waiting to get some feedback from a couple people, which is why I'm just sharing it with the full board now. If our board members can please look at these 2 dates. If we do not change them, our board meeting is going to fall the night before Thanksgiving and the night before Christmas Eve. So I propose changing our board meeting in November and December to 1 week earlier on 11/18 and 12/16. So if you can please look at these 2 dates, and I'm going to email them out to the full board. If too many people cannot make it, then we will reassess. But as it stands right now, my plan is to reschedule the board meetings just for those 2 months to be 1 week earlier. And I will email that out later. I can hear someone unmuted. Is there a question on these?
Julie, it's probably me. I got to figure out how to do this thing. Sorry.
That's okay. You're doing fine, Alita. Okay, and up next, I'm going to recap a snapshot of the data presentation and the takeaways from the model systems presentation from last month. And then our final work group will present on the current services, gaps, and efforts to address the gaps that we have here. And then we'll close with Dr. Aguilar. First, I just want to make sure to open it up for any questions for our board on any of those logistical updates.
I have a question. It's not quite on that. Is this a good time or should I ask it later?
Depends what it is, Carol. Go for
Well,
it.
it's a question that stems from ignorance. So I have to start with an apology, which I now give you. But the question I had is, what is the role of the board as the city council grapples with the camping issue and what to do about the homeless population that right now the city wants to post? And various people in other capacities I serve are sending letters and doing things like that. But this board is a board of major service providers. Is there a role that the board has and perhaps you've been talking to people offline, I don't know, but I know that people are asking me what's Hope doing about this?
It's a timely question, Carol, and I can give a brief response now. Hope's board is really to be data-driven and involve the whole community to adopt policy recommendations for the city and the county on specific topics, such as transitional housing or emergency shelter, care coordination. And Hope's role is not to serve as an ombudsman to come up with logistical solutions for specific problems, like where do we put someone who is living in a tent. But a lot of that work is happening in other forums. So the city has worked very collaboratively with service providers. And last week on Monday at the monthly homeless service provider meeting, we had many city staff attend to go over this proposed plan and to receive feedback. And they were very open to having partnerships and collaboration with service providers to come up with tangible feedback on that proposed plan. So that is happening, but this forum is more for a high level, data-driven policy recommendation process.
So when Hope wants, and perhaps this isn't correct, but if Hope wants a certain level of visibility and there isn't somebody at a council meeting saying, not necessarily ombudsman or advocating, but just simply saying, we are very concerned with our homeless population, blah, blah, blah. Just simply to have a hope oar in the water, is that something that the board is not that doesn't feel appropriate? Are you saying it's better to be behind the scenes, or?
I think Zan wants to respond.
I think that what we have decided at this point is that once we have an adopted plan, then we can stand up there and say, you know, this is the direction, this is the plan, and that is not consistent with what the plan lays out that has been approved, you know, blah, blah, blah. But at this point, we have been wanting to avoid that and avoid rowing in multiple different directions because we
I get
we
that.
haven't got that point
Yeah, that's
yet.
not my
So
issue. I get that. What I'm concerned about is basically people saying to me, Hope's not doing anything. We don't see them anywhere. We don't see their voices. So I'm just saying, are we comfortable with that, keeping that low level presence until we get to the ultimate plan, or is there a reason to say something beforehand? But so that's my issue, but I don't want to take a lot of time on it. I just wanted to represent to this group what I've been hearing and a little bit of my concern about profile, but I'm done with it. I'm going to mute myself now.
Thank you, Carol.
I do have one editorial comment. I think the summaries that Zan and Julie gave are accurate about our role, or I agree with it, I should say. I also think in order for us to fulfill our role, we have to know what's going on in the community. And I mean, this wasn't even a policy discussion at the city council level. This was an information only report from staff for reasons that were laid out in the staff report. And so there would have been no reason for us to give advice or have input particularly. But it also makes sense that for us to be able to do our job, we need to understand what conditions homeless folks face and what and what's evolving in our community as it relates to homeless folks. So I do think it would have been appropriate for city council members on the H.O.P.E advisory board in particular to have forwarded information to us or for city staff to do so. And just so we're educated, because we can't do our job unless we are educated about the issues.
Well, and Jim, you bring up a good point and something that was stemmed from the email you sent earlier on this topic that I think the executive committee in planning the agendas for future meetings, we might want to factor in a 5 to 10 minute period at future meetings for some updates about current work, what's happening, because as we're talking about this, I'm looking at some of the faces of board members who have no idea what we're talking about. And city staff from police and fire and parks and rec and public works and community development put together a draft proposal to begin enforcement of illegal camping ordinances in a phased approach. And that proposed enforcement was shared with service providers, and service providers were able to give some feedback, and that's only just happened in the last week. So I'm sorry if everything we've been talking about, not everyone on the board is privy to, and I think that's something that we can work on at future agendas to have an update on current events and what's going on at our meetings.
Hi, this is Charles, if I may chime in.
Thanks, Charles.
So I agree with what Jim's saying about, keeping the board updated. However, in this situation, council wasn't even aware of these phased approach until the packet came out for this last meeting. So we were all kind of in the dark about it, besides the brief, conversation with service providers. So, but I totally agree. It'd be good to get updates. Maybe that's something that we can see if we can get city manager to provide witness information that would be appropriate.
Thanks, Charles. And I'm seeing a question here that I don't actually know how to answer, George. And the question is, who asked for the proposal to be drafted and presented? Joel, maybe you know the answer to that question.
I guess I don't necessarily understand the question in its entirety.
So let me explain it. It's pretty straightforward. I mean, I don't know. I'm just wondering. Charles was just saying that came as a surprise to them to see it. somebody had to ask for a staff person to spend time on it and draft it. So I'm just wondering where it came from and who asked for it to be put together.
I believe the staff report was produced just to advise council of what's being done in relation to the issue.
Well, I'm just wondering what department it came out of and who, and you know, how did it get initiated? How did it get initiated in the city if the council didn't ask for it?
Community Development and Police Department.
Okay, so somebody.
Yeah, George, my understanding it stemmed from, you know, they've been working on it for about a month and a half, and it started because of a lot of responses to fires that got out of control at camps and police having to also respond to camps. So I guess that's what sparked the conversation, and then city staff started trying to figure out a way to address it.
Yeah, it makes sense. It makes sense that you've done something a little different. It makes sense to ask about it and say, as we move forward, how do we proceed with doing this? You know, and that makes sense. I'm just wondering where it came from because it kind of comes out of the blue. And like,
So
if it came out of the blue, it's kind of a surprise. So let's just figure it out.
So George, it's been I guess you could say it's been brewing for some time now. What's happening, and this is more than anecdotal, it's actually what's occurring is that we're getting a lot of migration from surrounding communities because Corvallis doesn't have any restrictions, and some of this is high level. In other words, can we talk with Lynn County, or can we talk with the city of Albany and that sort of things, that we can understand how this dynamic is going on. You know, there's Albany is cutting back on their ability to take care of these homeless. Maybe Eugene is expanding. And anyway, it's looking at it regionally is one of the things that community development has found is having an effect here. It really is having an effect. And since we don't have any form of regulation, we can't really contain the situation. And then with the reports, which were rather stunning from the fire department and the police department, in terms of the environmental, well, not just the environmental outfall, but safety data is pretty strong. It is very, very strong. So what we now have is the parks are the operative go-to for homeless camping sites. And without some form of regulation and setting expectations, we really have no control over the situation. So from a city management point of view, the city's purview is to find funds for social agencies to do the jobs that they do best. The city has other duties, which are to maintain public safety, maintain the our parks and our public right-of-ways and law, whatever else that, fire and
Jan,
police.
I'm so sorry to interject, but we have a lot to cover today,
Okay.
and we're getting off topic here. But thank you for trying to help answer George's question. Peggy,
And
last
just
thing.
one other thing about that. I'm not concerned. I mean, it's Charles was saying, it sounds like it came out of the blue. It's a perfectly rational question to ask in terms of what are we going to do as not only as maybe we get to a point where we have to start saying it's becoming a bigger issue, and so we need to be able to address it. And they're doing a good job of trying to work and come up with plans about where can people camp and camp legally. And so it makes sense to do it. It's not a problem. I'm glad you looked. I just wondered how it got started. If it comes as a surprise to the council, somebody had to say there's a problem here. Okay, so let's address the problem and talk about it, because that's part of what we do. That's part of what our role is how do we help them address that?
Thanks, George. Peggy, did you want to say one last thing?
I do. So I felt like Jim characterized the situation well, and as well as others, that until we have, and Zan as well, until we have a formal plan, that I think that, we have to not go forward and say, yes, this is consistent with what we think, because we do represent a broad range of thoughts. And in the meantime, I thought that what Reese had posted on the Corvallis homeless page on Facebook was wonderful. It was very informative. It was a really balanced response and laid out the facts. And I think that all of us can have opportunities to do that kind of thing up until the time that we can make these formal comments as the H.O.P.E group.
Thanks, Peggy. Appreciate you guys all discussing this.
Can we have a placeholder maybe sometime to discuss in the future about some things that would, along some of the mythology. I mean, people may be coming here, and I think that's reasonable to think they would. But if people come here, they're coming here because.
George, I think you just got muted.
We're not going in with we're not automatically going into sites with heavy equipment and tearing things out. We're taking a rational approach. And so it's no different than any other community that takes a rational approach to where people are going to live, that people want to live there, and so we just need to be prepared to deal with what we have to deal with.
Okay. All right, so I am going to give a brief recap of what happened at the last two meetings. But first, I'm just going to remind us of why we are doing this process, which is actually quite a bit of what you were talking about just now. But really having the bylaws guide this work so that we can come up with a plan that is supported with input from a wide variety of the community. So use data, take a comprehensive systems approach, involve the community, prioritize vulnerable populations, promote community safety for all, and promote racial and ethnic justice. And it's why we broke into work groups the way that we did, to look at full systems, to look at the data in our community. And then tonight we're going to hear what we currently have in Corvallis and Benton County. I'm going to review just some high level parts of the data that really looked for disparities in racial and ethnic demographics, vulnerability factors, and safety concerns. So this is just a snapshot of some of the data that came out of the July meeting, where you can see that based on percentages of race and ethnicity in Benton County, we have overrepresentation, huge disparities among individuals who are Black, Native American, Pacific Islander, and Hispanic. There is an underrepresentation for people who are white. The next thing we did, which I reported out at last month's meeting before the model systems group, was to look at how those percentages translated to numbers of individuals who are affected. And so I looked at the men's and women's shelter population. Barbara and Nikki looked at a lot of the different data from our providers in this area to look at those disparate percentages and come up with numbers of individuals affected, so we can really quantify the impact that these disparate percentages have in our community. And this has already been presented at last month's meeting, so I'm not going to spend a lot of time on this, but I just wanted to recap it for people who might have missed the meeting. So just to explain it, these are our different populations where we have data. Unstably housed in yellow would be from CSC, individuals who are getting rental assistance. In the gray, we have individuals who are utilizing vouchers from Lynn Benton Housing Authority. In red, we have homeless individuals from the point in time count. And in blue, we have the census data from all of Benton County. And to recap the numbers where we're seeing individuals who are affected on our housing spectrum, individuals who are homeless are in that first column from the point in time count. Other individuals who are experiencing homeless, that data comes from the Corvallis Daytime Drop-In Center, our emergency shelters, the school district, thank you Sarah Devine, and Jackson Street Youth Services, thank you Ann Craig, I think I saw both of you on the call today. From transitional housing, the majority of our data came from Community Outreach Incorporated. Ty, I think I saw you for the first time today. Great to see you guys all on this call. And then for housing and homeless, hi, good to hear you. For housing and homeless prevention, so these are people who are housed, but they are receiving assistance from CSC with rental assistance or from Lynn Benton Housing Authority with a Section 8 voucher. At the August meeting, the work group presented on model systems of service and delivery, and they looked at a recommended model, putting together the update to the 10-year plan, the Econ Northwest study, and recommendations from the National Alliance to End Homelessness. They presented successful models of care coordination and coordinated entry. We looked at UBA, we looked at a hub and spoke model of care coordination that is successfully being used elsewhere. And the model systems group came up with this framework that combines those recommendations where crisis resources are aligned and permanent supportive housing is a crux of the housing that keeps people out of homelessness. This is another visual that represents that group's presentation on what a model system looks like to align your emergency response and shelter resources in one area and have case management along the whole spectrum of housing from emergency to stably housed. These were the 3 takeaways from last month's presentation on model systems. Align our crisis response resources, which means co-locating services with emergency beds. Really improve coordinated entry and care coordination with providers. Data collection and outcomes are improved, and the hub model shows success. And then increase our units of permanent supportive housing. That's a necessary component to prevent the cycle of returning to homelessness. So our presentation for today, let me check our time. I think we are great for time. You guys have an hour. This group will present the current housing and services spectrum here in Corvallis and in Benton County, the existing resources we have, the gaps in our system, and the current efforts to address those gaps. And just so everyone understands the process we're going through, the first part of the presentation is going to be Corvallis centric. And then after we review the Corvallis resources, there'll be a separate presentation on resources outside of Corvallis and the rest of Benton County. And the presentation outline, the order of things, is going to follow our housing and services spectrum. So we'll start with behavioral health, go to resource navigation, emergency, transitional, permanent supportive, and housing and prevention. I am going to hand it over to Zan at this point. Zan, the floor is yours.
Thank you. I will be speaking about the behavioral health intercept, if you will, of our continuum. But first off, I want to offer a few definitions. Behavioral health is really a large topic, and I could speak for the whole hour on this topic and probably not do it justice. So I'm going to be fairly brief, but we probably, well, hopefully we'll have some time for questions at the end. So behavioral health is focused on treatment and prevention of mental health problems, addictions, and substance abuse disorders. And we have a system that's really divided into mental health crisis focus and overall mental health treatment on an ongoing basis, and that stabilization and prevention. So you'll hear about crisis services and about ongoing mental health and psychiatric services, both. And a mental health crisis is any time when a person's behavior puts them at risk personally of hurting themselves or hurting others, or keeps them from being able to care for themselves or function effectively in community, based on the National Association on Mental Illness, National Alliance. You'll also hear me talk about severe and persistent mental illness, or SPMI in the jargon, which is a limited set of diagnoses that receive priority for psychiatric treatment resources. And this is schizophrenia, schizoaffective disorder, clinical depression, bipolar disorder, things of that nature. And that preference is something that is found in state law and in federal funding sources as well. So it dictates to some degree how we can use certain dollars. And lastly, street outreach and response. Coordinated street outreach basically engages with people that are living unsheltered and helps ensure that people's basic needs are met in order to engage and support, build trust, and hopefully build relationships to move people towards housing stability. So I'm going to start out talking about street outreach and response in the context and behavioral health crisis response first. This is what's going on now, and then I will address the gaps and what's evolving in the next slides. In terms of street outreach and response, there are several different resources. As you know, from Anita Earle's participation here, Samaritan has a homeless resource team, and that is 2 licensed clinical social workers doing a lot of work engaging with our most medically fragile. partly because of the fact that those most fragile folks cost the emergency department and the hospital a lot of money. But if we can work with them early, it saves everyone money, and the health outcomes are far, far better for the individuals. There's the street outreach and response team, which is an all-volunteer team from local nonprofits. Jackson Street Youth Services has outreach, street outreach for youth. Chance has peer mentors for recovery and a drop-in site in Corvallis now. The Benton County harm reduction team has a different mandate, but they work with the homeless population a lot. And their main mandate is to provide services that keep addicts, for instance, from becoming sick with hepatitis C by providing needle exchange and providing water and providing that trusted relationship. And again, engaging people to help move them into a better living situation. And lastly, county health navigators who are located in various different agencies and who can help sign people up for Oregon Health Plan and help stabilize people's health, et cetera. Behavioral crisis, health crisis response, the Benton County has a mental health crisis team and operate the crisis line here for the county. This is a core function of county health departments. We provide that service, and there's an after-hour on-call component as well. We have mental health jail services, and there's the Samaritan emergency room and psychiatric unit. And so those, part of what I would like to point out is that for all of these kinds of resources, when it comes to the behavioral health crisis or some of the other resources, sometimes you have to be in crisis or you have to be justice involved with the legal system before you get any help. Not necessarily the most logical or positive way to address the issue. With respect to substance use disorders, alcohol and drug treatment, Benton County offers outpatient treatment. And I don't know what the waiting list is for that right now and how heavily subscribed it is. There are also Oregon State University programs, there are counseling and psychological services, and the Human Services Resource Center that have can help people get assistance in the OSU student population. And then there are lots of treatment providers like Milestones and the Janus House, Samaritan Health Services, new facility over in Lebanon, but these are all by referral only, and they all have waiting lists. And in terms of ongoing and supportive mental health treatment, Benton County again plays a huge role. There's outpatient treatment primarily for folks who have severe and persistent mental illness that have graduated from the assertive community treatment team at the county. The ACT team is a wraparound service that can help 70 people at a time and provides everything from housing and intensive counseling and stabilization of medication and employment supports. It's a real wraparound suite of services. And then again, the jail service and then the drug treatment court. A drug treatment court in Benton County right now has a dual track, and most of the folks that are involved in drug treatment court have a mental health diagnosis as well as a substance use challenge, and they all receive ongoing mental health treatment. And then the new resource in town is the Pathfinder Clubhouse, and that is a place to be in the daytime for folks that are have mental health diagnosis, where they can stabilize, socialize, have some early experience with supported employment, and then supported employment out in the community. And that resource just opened up, and it's available only by referral right now. For youth, there are various resources, but again, mostly by referral, some of them only after you've been involved with the justice system. So there's the Children's Farm Home, Yes House for Substance Use Disorder, Old Mill that provides counseling, especially for the youngers. The Benton County Juvenile Department also has a counselor on staff, and then the Jackson Street Youth Outreach Program again. When it comes to gaps, as I mentioned before, the county's assertive community treatment program is it's limited to 70 clients and only with specific diagnoses. There's a shortage of psychiatry in town in general, whether you are unhoused or housed. And there's a lack of housing and both supportive housing, permanent supportive housing, and in general housing. There's insufficient both resident and outpatient substance use treatment slots. Even with the new STARS facility over in Lebanon that Samaritan Health Services just opened, there won't be enough residential and outpatient treatment. And though that clinic will receive people from all over the state, there's no monopoly on it for our Lynn Benton Lincoln area. There are no medical detox facilities. So if someone is using, a heroin or in meth, there's no medical detox location for them. And that is a huge barrier, especially if someone is wanting to start treatment, but they have to get over that hurdle. And there's no standardized assessment or coordinated entry across all of these different services. So I think it's really challenging for people to get stuck in one pipeline and then another and not be able to get through and find the best treatment for themselves. So there is work in progress. The county's working with law enforcement, with both the Corvallis Police Department and Philomath, and with the Benton County Sheriff's Office to codify some of those behavioral health partnerships so to respond better. But there's it's very, very early stages, and there's talk about the cahoots model, for instance, and working more closely with mental health or having joint patrols. But again, early days of any of those things is just conversation. Also, in the context of the criminal justice work the county's doing, we are talking with partners at OSU and Samaritan to discuss a crisis respite center where anyone could self-refer if they were having mental health crisis or needed have their meds adjusted and needed to contact a provider, or a place that was residential for up to 30 days where people could be and not be in jail or not be on the street if they're in crisis. There are also some legislative initiatives to increase the flexibility of funding streams around mental health, because it's very difficult for anyone that has state or federal funding in this arena to try and provide a functional program because the dollars are so limited in what they can do. And of course, that Samaritan Treatment Center that's opening. When it comes to street outreach, Samaritan's doing and Anita and her team are doing a fantastic job, but there are only 2 of them, serving all of Benton County and often working in Lynn and Lincoln County as well. So I know Samaritan's talking about expanding further. The street outreach team is a full volunteer group with other full-time jobs and are out only 1 day a week. Jackson Street Youth Shelter, a youth system, is focuses on the 12 to 25 age group only, and again is limited in terms of staffing. And there's no full-time peer response that's immediate, that's linked to 911 like the Cahoots model down in Eugene. I've already mentioned what's going on as I've worked through this, so I don't need to address that specifically. This is looking, I think
sorry, Zan, I put in 1 extra, and that's not your fault, it's mine. Okay, I think we are done with the street outreach and response.
Yep.
Yeah.
So that's where we are right now. And I find this very frustrating a piece of the puzzle, because it's a system that's extremely difficult to navigate and hard to actually get services unless you are in crisis. And even then, it often doesn't resolve with a helping hand. So we can do better.
Thank you, Zan. Our next presenter is going to be Alida, looking at coordinated entry and the resource center. With what we have here, our gaps and efforts to address those gaps. Alida, I'm gonna hand it over to you. You can go ahead and unmute yourself.
Oops. Thank you. Yeah, there's so much to talk about. We need several weeks, but coordinated entry is defined there on your screen. And this is something that really is very helpful to all of us who are providers. And also the problem though, of course, is getting all the data, and that sometimes is a little bit egregious to the people who are trying to give you the data. But nevertheless, the idea of coordinated entry is a process by which the people experiencing homelessness are given access to housing and assistance based on their level of need. So it's a triage system. But I know, like, I'm going to be talking about the daytime drop-in center, and we don't have ourselves hooked up yet, but that's one of the things that we're working on. But the shelters do have a pretty good system of keeping data, and that'll be spoken about as well. But the next part there, the resource center definition, was brought up earlier in some of the slides, but we went through that one big slide really fast. I think it was on another page. I can't remember which page it was, but it's basically a physical location that's open daily year-round with on-site providers to enroll people in programs and support individuals to transition out of homelessness. And our example of a resource center is going to be the drop-in center, and I will try to show you how we try to provide as much of a hub for partnerships so that we can do what this definition says. However, we don't have people who are stationed in the building. In fact, we don't have our guests in the building at this moment due to COVID, but we have some system in which our providers are able to come in the afternoons now that September is coming, in the mornings from 9 until till noon. We have our usual program, which will be on another slide. I believe we have, yeah, so, but we'll go back to that in just a minute. We serve people every day, Monday through Friday. We have, in the summertime, it's from 9 until noon, and in September, we start adding, usually people can stay until 2. But now that we can't come in the building, our noon to 2 o'clock is a scheduled program where our partners, some of our partners are able to come into the building, and they take names down as to who they can see. People ask to be seen, and then we work them into a slot. So some of the things that we're doing in the afternoons are, we have counseling on 1 day a week, 2 days a week. We have the nurses from, a nurse from Samaritan and a health navigator from Benton County were there today. That was pretty awesome. H.O.P.E, one of the folks from Samaritan, H.O.P.E and Anita are partners, and H.O.P.E was there today. So we also have people from Housing First who are case managers that come 2 days a week, and it's just expanding. So those appointments are really, really full. But let's go back to that slide that shows the CDDC as the center. I want you to, I know it's really small print, but to think of this as how the model one would work, is that there's a place where people don't have to just go all over town to get services. When we have a guest who needs something, we have a link to a partner, and we have links to all of the people that you see around there. It's not a formal MOU or anything like that, but some are stronger than others and are used more often. For example, the street outreach and response team at the top, that's sort of their vests are housed at the drop-in center. They come there on Fridays and they pack up, and then they go out and do the function that Zan described. Another one that I wanted to highlight is the one that's down at the bottom. It's got little spikes out from different sides. We have a lot of a relationship with Benton County Health Department and their health navigators and the mental health department. We have Chris Gray, who comes twice a week, and actually scheduled twice a week, but he's there almost every day for some reason or another to help people with crisis management. And we have people with Community Services Consortium that are scheduled on 2 days a week to work with people, and that's been a real blessing. So that's just starting to show its value now that September has come. Some of the others that are just our daily push the button. We need to call Vina Moses for some clothing. If we don't have something, we have to call Love Inc., Stone Soup. We work very closely with them, awesome. Unity Shelter is just getting started, and that's gonna be a wonderful relationship because that's the housing part on a continuum from rough camping to permanent supported housing. So just the idea of this partnership is what I want to communicate with this piece. So you can turn the next one. So resources that we have here in Corvallis is the one I just was speaking of, the Corvallis Daytime Drop-In Center, and those things that you see there with the info dots are what we have on a little card that we send out with the SORT team or that we give to people when they say, so what do you do? Well, food and phone access. We have mail for about 600 people. Access to health providers, as I mentioned, the Shiho and Amaranto and the new person, Nancy, were there today. We have also prescription assistance. We often have a grant that can help with that. Counseling, we have a counselor there twice a week. Emergency transportation. We don't have a lot of money, but if there's an emergency, we partner with a lot of churches to try to get people where they need to go. We have a program called H.O.P.E, Homeless Employment Launching Project, which gives people a little bit of a experience, a little bit of money, plus it grounds people in helping them to get some employment, and it's all above the table. They have to pay taxes, et cetera, et cetera. So, and there's training involved with that. Assistance with vital records. We help people with obtain their IDs and birth certificates. And then just our Project Action Office is always there to help with personal hygiene items and stuff. We have a limited pet assistance program that just because there's a lot of folks that really feel strongly that that's an important ministry, and they do it. They bring us their issues and their money, and that's wonderful. So that's what the Drop-In Center is kind of in a nutshell about. We have a website, you can check it out. It's called corvallisddc.org, and it's got a lot of information there. Okay, another resource on this idea is the Hygiene Center. Right now, it's at the site of the Men's Cold Weather Shelter, and they have food from 1 to 6 every day, and they also are mirroring the Stone Soup program that would be on the days that Stone Soup provides food at St. Mary's, because at the Hygiene Center, also it's a site where people are sheltering in place. And that's been a real interesting situation for the Drop-In Center as well, because what we noticed when COVID hit is that when the Drop-In Center had 120 people usually coming a day, it dropped because people were able to shelter in place. And I use an idea called horizontal and vertical thinking. And horizontal thinking is like what you do when you don't have a place to lay your head down and you're worried where your stuff's going to be if somebody steals it, if you leave it somewhere. So once that was taken care of, people were starting to think horizontally. They could think a little bit more about what they needed. And now what we're seeing in our afternoon appointments is people coming from the center and actually dealing with issues that our resources and our partnerships can address. Chance is another resource in the community, and they have a daytime drop-in center. It's not a low barrier, but they do many of the same things that we do, and we partner with them, send people both directions, and it's been a really good relationship. So some of the gaps that we see are, of course, that their on-site behavior of health and housing case management isn't every day. That would be really awesome. Open hours are limited. We're a volunteer-run organization. Only in June did we hire our very first at the drop-in center an executive director. It's the first time we've had a paid person to do that. Also, the gaps in the community are there's a year-round hygiene access is missing. There's only one shower at the hygiene center. We've often, from the drop-in center, used the Methodist Church 1 day a week, but they are now doing such a good job sheltering the women's shelter that resource isn't available to us any longer. So the hygiene center, as you know, here comes the rain, so we don't know exactly what's going to happen for the winter shelter needs. Laundry access is also interesting. That's why one of our spokes from the drop-in center goes to Vina Moses and also now to the hygiene center for people to get their laundry done. But that's not very much when you think about how much laundry you and I do every week. The part that's the biggest gap, and I like to think that in my conversations with our guests, my data is probably really strong. What I see is that their sleeping space is missing. We can't have people sleep there, although if they haven't had enough anywhere else, they may fall asleep there, but they have to leave. And the other day there was a gentleman, young man, who just couldn't wake up. And today he was in such bad shape that I got to work with the other 3 people in our partnerships to get him to the hospital. So lots of things happen when there's no sleeping space in our community for sleeping during the daytime or whenever your body says it needs it. So there's some work in progress. The drop-in center has an intern right now for mental health intern, and is supervised by a LCSW social work person, and we're very excited about that. Also, we're working toward offering more behavioral health things on site, and having our area where we meet people be a little more private for some of these things to happen more securely. We're working on expanding our data collection system to be more like what Zan was talking about what we mentioned at the beginning of having a system that works all throughout the different agencies and can help people get what they need faster. Hygiene center, shower access, that would be a really good thing to have more of that at the hygiene center. And the county's working on partnerships to explore the crisis respite center. And I think that that's just about all that I had to say. If there's anything that I missed, I'm not sure.
I think you're good, Alita. Thank you so much for that really thorough presentation.
Thank you.
Next, we are going to look at our resources for shelter, the gaps, and the efforts to address those gaps. Christina, I'm going to hand it over to you.
Thank you. Here we have our definition provided by HUD of emergency shelter. Any facility with overnight sleeping accommodations, the primary purpose of which is to provide temporary shelter for the homeless in general or specific populations of the homeless. Okay, so on the emergency shelter, this is what we do have. We do have the women's shelter, which allows pets through November and March. We have the men's cold weather shelter, November through March. We have the Jackson Street Youth Service, community outreach, and the Center Against Rape and Domestic Violence. The gaps, this is what we see. Shelter beds for all populations. No low barrier shelter for families, couples, pets, transition, age, youth. We need space for co-location of service providers. Men's shelters not all year round, not enough beds or spacing. The women's shelters not all year round as well. There is no place for car, RV, camp for emergencies. No RV car camping at, there is RV, not enough RV camping at fairgrounds is a COVID response only. The tent camping at the fairgrounds was for wildfire evacuees only, and there's no RV dump sites. Is that the end of the slide? No RV dump sites besides?
No RV dump site besides the fairgrounds.
Okay, I didn't, that last, okay, sorry.
No, you're fine.
Okay, what we are doing and what is the work in progress is the city, county, and Unity shelters working on alternate options for men's shelter population. And because of COVID-19, the capacity is dispersed, micro shelters at churches as well. COI is hoping to expand the transition aid shelter capacity and getting funding to keep the women's shelter open all year round.
Thank you, Christina. I'm going to pass it over to George. George, if you can unmute yourself and take over for transitional housing.
Oh, thank you. So what we've been hearing about are the services that are there to essentially assess people when we find that they come into our community or that they're in need of services and are not having a place to live. What I'm going to be talking about a little bit is what's needed above and beyond that. So when we talk about the emergency services, about where people get assessed, where they get initial access to service, and they have a stable place, at least for a period of time, to stay. But we're going to look at transitional housing, which is a place where they can go for a longer period of time to continue having that period of stability. And this is the definition that we have, that we've come up with. And I believe that came from HUD as well, correct, Julie? Yeah. Okay, so let's move on to the next slide. So in terms of transitional housing, there's a wide range of services that are available, and you can see under the resources on the left side of that slide, the service providers that are out there. But what we find is they're all their own silos. And so they all have different means to access them. They all serve a little bit different populations at different times and different points on the shelf. There isn't a lot of consistency across there, but there is a significant number of transitional providers. The gaps are capacity for low barrier options. So when we see people that need transitional, that are appropriate for transitional services, there aren't a lot of options for them to be. I mentioned that we're limited by the populations that are served by the service providers. We don't have a permanent camping response, and the tent camping that we have at the fairgrounds has really been used only for COVID and fire emergencies. The good news is, under transition progress, micro shelters are expanding, and the city and the county are really doing a good job of working together to look at the things that they can do to really come up with a plan to say, let's get people in a place where we get them stable and get them services. And that's going to include options for transitional housing there as well. So we can go on to the next slide, unless people have questions. Once you're out of transitional housing, once you've been in transitional housing, it's a limited period of time. You're not going to live there forever. You may be appropriate for something that would be permanent supportive housing. And permanent supportive housing is for people who probably are not going to live independently without accessing services at some level. They're going to need some type of support in order to be successful in the community. And these are the kinds of services that, well, this is the definition for it, and the kinds of services that you see down at the bottom would be, the substance abuse, the mental health, the vocational employment services. I mean, this is a permanent supportive housing. If you said earlier about somebody with a severe and persistent mental illness, likely going to be in connections with the system for a long time, and many times permanent supportive housing would be an appropriate place for folks with those conditions to be. Next slide. So not as many providers here under resources. Corvallis Housing First has been doing this for a while. They have a couple of different options available for people. Dev Northwest is the largest developer that's provided transitional housing, and County Mental Health has transitional housing as well through parole and probation and other programs that they serve, and mental health programs. Again, a huge gap in capacity compared to the need. And again, people get siloed, so different kinds of things for people with different conditions and different needs within particular populations. What's happening? Corvallis Housing First has a Meyer grant, and they're working on adding additional transitional units to the community. Dev Northwest is expanding and continually working for those looking for opportunities to do that. And Community Housing, Cities Housing and Community Development Advisory Board is using the construction excise tax to be able to fund projects which could increase the number of permanent supported units in the community. Housing, this is kind of the big thing, because this is the one that I see is kind of the big problem. There's housing is a place where everyone has a safe and decent place to live. Resources, private developers, we've been trying for years to say we'll build more houses and that'll lower the price. If we have more houses, that will lower the prices for everybody further down the line. It hasn't worked, so Habitat and Dev Northwest are the nonprofit providers that are putting units out there for that. But you can see the 4,800 number, I believe, comes from a 2016 report that was done for the city. I believe it was Eco Northwest that did it, that said at that time they needed 4,800 units. That's probably still pretty close to the need, but it's still, we're still a ways away from that, 4 or 5 years out from that report. That number's probably bigger. What's happening there with South Corvallis, with the Urban Renewal District, that's going to, again, make space and funding available for more units to be able. And I'm not familiar with the Commonwealth, with Commonwealth funding, but I know that there's a project for 53rd Street that's been developed by a private developer, which is a new thing. So, but we need, this is the place, if we can get people in, assess them, get them connected to services, that's really great. But if they don't have places where they can go and be and live as independently as they can conceivably live, then we're going to be stuck kind of in the same cycle that we're in now.
Could
That's it.
I add just one element to the housing piece?
Oh, thanks. Yeah.
That we didn't put in, and that's the Lynn Benton Housing Authority and the housing, the Section 8 voucher program.
Yeah, how did we miss that?
Yeah, I don't know.
I know
it's under, I think it's under prevention, Zan. I think it's coming on the next slide.
Okay.
Yeah, here we go on the next slide for prevention. It's one of the ways to prevent people from falling into homelessness. So I didn't put it under housing because we, well, for a variety of reasons, but. George, thank you so much for your presentation. I'm gonna move on to the next one, which is prevention. And Lennox, I'm gonna hand it over to you. You can go ahead and unmute yourself. Thank you.
Okay. As far as prevention, we already mentioned just now the Section 8 program, which is federal, but here it goes through Lynn Benton Housing Authority. There's also short-term rental assistance, which this slide is a little emotional for me, honestly, because I just remember when I was losing my house and how stressful that was, and I couldn't think of anything to help, So, yeah, so housing, losing your house, preventing that is like huge. There's also utility assistance. There's Dev Northwest and CSC tenant counseling, strengthening rural families, which I think is pretty cool because homelessness is not a city problem. It's everywhere, so having that is really important. And then there's schools as well. As far as the gaps that we're noticing, there are huge gaps in the amount of units, just a place to put these people. We need about 4,800 and we don't have that. So that, and then also more vouchers would be really vital to making this program sustainable. Speaking of sustainability, we have kind of limited rental assistance program right now for COVID. So that's cool, but also it ends at the end of the year. So a lot of people are going to be kind of like wondering what the next step is. So good work in progress, but still kind of leaving a gap in a way. And then another kind of work in progress, but not really happening right now, is state funded vouchers to supplement the federal funding, and those are just on hold because of financial restrictions. So again, the importance of this data-driven approach, because once you present the numbers to people, they're willing to present the finances to you. So as far as prevention, we do have some good things happening, but we have some way to go.
Thanks, Lennox. I think that was it for that slide. Yes, thank you. So this is a summary slide. I know there's quite a bit on here, but it's in a visual way trying to summarize the presentation that you just heard in multiple different areas with behavioral health crisis and treatment, with street outreach and response. Let's see. Zan, do you want to share your chat with the group verbally?
Oh, sure. I can just briefly say that the state's revenue forecast came out today, And whereas the last revenue forecast was very doom and gloom, today's was much more positive, and the state expects to have additional resources moving into the next biennium, a 2-year budget cycle. So that state-supported housing voucher program might actually be a possibility, and I would expect that that would be something that there will be a lot of housing advocates pushing for.
Thank you. That's great to hear some good news after the report of all the gaps. So this is sort of a summary of everything that this work group put together and presented for you over the past 40 minutes. So you can see all the gaps listed and the current efforts across our spectrum. And I'm not going to go ahead and read through each and every one of these because each of the group members just did that. But I think this is a good way to see it all together, to see our gaps and efforts below, so we can kind of see the action that's happening in the community to address some of the gaps and where there's more action and less action. And I'm gonna, if there are any questions about the Corvallis part of the presentation, we can take those now, and then we'll move on to the rest of Benton County.
A question.
Yes, go for it.
The voucher issue, I was at a presentation that Donna gave, and she said the issue isn't so much the vouchers, it's there's no place to use the vouchers. So even if we had more vouchers, more funding, there's no, that the backlog, she said, was something like, I don't know, a year for anybody to get a place. So is there more update on that?
It's 2 years.
2 years.
And
Okay.
that makes it even worse.
2,000 people, 2,000 people and a 2-year wait list.
And of course, if you don't find a place within a month, then you fall down to the bottom of the list again, which is even worse. Can you imagine how dispiriting that is?
Yes. So is getting more money for vouchers a good thing?
It depends on how the program is structured. And the problem for us is the fact that the voucher, how much the federal government will pay for is dependent on these federal formulas about what it should cost to rent a place in the particular geographic area. And of course, the housing costs in Benton County are much higher than they are in Lynn County. And yet we're part of the same region for the formula. Most of the housing units here in Benton County are just out of reach if you have a voucher. If the state program is structured in such a way that it will supplement what's available on top of those federal vouchers, then it would allow for more people with vouchers to actually find places in Benton County. If it's just providing additional numbers of vouchers, it might not help us in Benton County. So I think an awful lot is going to depend on how that state supplement is designed.
I think the issue, though, is my experience is we don't have enough housing, period. It doesn't make any difference how much money you have. You can't rent a house.
Well, and the other thing that my experience shows, during my time as a property manager, this is Charles, by the way, is that a lot of people didn't understand when they applied to get that voucher that they should start applying for apartments right away. Because, anywhere that's affordable has a long, almost a 2-year waiting list. So yeah, that they get their voucher and there's nowhere to go. They end up losing it.
There is one more strategy that could help us bridge that time between now when we don't have enough housing units and the ones we do have are too expensive. And the other strategy that would help Benton County get its fair share of voucher recipients is if there was more use of place-based Section 8 assistance. And what that means is that the Section 8 assistance is attached to specific housing units. And so that would provide, I guess you would say, a sort of a protected resource of voucher assisted housing that stays with us instead of getting lost to a market that's too expensive and with too low a vacancy rate. And so I would certainly, I wish that the Lynn Benton Housing Authority would get to a place where they were willing to do place-based housing vouchers in Benton County.
Thank you, Jim. I was going to chime in with that as well.
Jim, this is Catherine. I wonder if I could ask a question about that. So the designation, I'd not heard of, that's a new thing that I'd not heard of before. is that the type of thing that is regulated then by like the Lynn Benton Housing Authority, or is that something that comes into play when you develop a new, you know, say like a new development comes in and these are just required? So my question is who is the governing authority, and where do those restrictions, you know, to secure that voucher assisted housing, where does that come from?
Well, there's two ways that place-based assistance ends up getting provided. In the past, it happened more commonly when a developer or a property owner got special financing through HUD, which didn't go through the local housing authority. It was financing provided by HUD. And so our community has a number of places like that. An example is the Julian Hotel downtown, the Samaritan Village out on 35th, and there's some other places too. And the housing authority administers that, but the award of the assistance is from HUD. The other way that it happens is with the housing authority using some of its existing program and putting it into place-based vouchers. And that ends up being a partnership between the housing authority and the property owner, because there has to be both, and that certainly continues to be administered by the housing authority. But it starts with a policy decision by the housing authority to actually use this capacity that they have that they're not using right now in Benton County.
And another piece that there's some project-based vouchers through the VA too.
Yeah, for
good
veterans.
Point, Peggy. Yeah. That there's Dev Northwest has a number of housing units that are where the place-based assistance where the voucher assistance is provided through the VA.
So just one more quick question, if I could. So the Lynn Benton Housing Authority has this authority. Does that apply then to like city, municipalities, and government? Do they have that authority over like the city of Philomath, the city of Monroe? Nope, Julie's shaking her head no. So does that have to come from internally, you know, municipal code languages, legislation that they might adopt within those cities to encourage developers to encourage nicely, nudge developers to include this type of thing within a city?
No, it has nothing to do with what cities can do other than indirectly. I mean, the city of Corvallis helps fund affordable housing, so the city of Corvallis may have some influence. But the Lynn Benton Housing Authority has control over that decision, and they are a public nonprofit two-county organization with its board of commissioners appointed by the county commissioners from the two counties.
Okay, that helps fill that picture out a little bit better. Thank you.
Well, and Catherine, you can go ahead and remain unmuted because I'm handing the reins over to you. We only have about 8 to 10 minutes before I'm going to hand it over to our equity consultant. So just keep that in mind.
Very good. So this is our resource map that shows our strengths and our weaknesses in Benton County. You can see there's a fair amount of coverage here, square miles, and minimal support, sometimes no support at all. It's largely representative of supports our food banks. You've got a little bit of health services, but it's really pretty restricted, and it's probably more reference than it is actually location-based. Soup kitchens, the Gleaner programs, there are a few of those in these areas as well, but overwhelmingly we're pretty deficient on a outside of Corvallis spectrum. The fact of the matter is that most folks in these areas are not going to be able to reach what are considerably better resources in Corvallis without actually moving into Corvallis, and that's not practical for everyone. There is of note here, Kings Valley has a small informal network that is supporting out there, and that one I don't think we ended up getting on the map, but this is kind of what you're looking at for Benton County.
I was able to get it added to the map,
oh, did you?
Catherine. It's up there.
I have a really teeny little map. I'm actually sitting in my vehicle in the middle of a parking lot, so bear with me.
No, you're
then
fine.
It is there. All right, so, and that's, you know, there's support sometimes that we can't recognize because they're informal. But the fact is we're very deficient in our rural county areas. So go ahead with the next one. There it is. And again, it's really teeny. So give me a second to catch up to that one.
You're fine, and let me know if you want any assistance.
Okay. So here you see actually a lot of blank spaces, and that's really kind of the point. We have almost no crisis response, certainly no formalized street outreach to people in rural areas, even in, Philomath, which is right around the corner from Corvallis. We just don't have those kinds of supports. Behavioral health falls into that also, although they're working on developing some of that for Monroe and LC, which would make a great difference to those communities, as there are some significant populations there. But to date, that has not manifested into a full-time position in those areas. Emergency shelters, we were unable to find any officially. My experience in those communities is emergency shelters amount to somebody's backyard camp trailer or RV parking place somewhere out of sight, garages, couch surfing, all those types of things. There just isn't that kind of structure there. And likewise, you'll see that in a resource center. And there continues to be talk about the value of what a resource center would be. I would love, I don't know that you have to go back to that slide, but what Alita was talking about with the CDDC and what that offers to a community. And of course, it relies on all the partners around that resource center also. There's been brief conversation and certainly very, very preliminary conversation of what would it look like if we could take that resource center idea mobile into these communities once a week, for example, just to get some sort of support out to these areas. The food banks are probably one of our strongest, most consistent and reliable sources of support for the unhoused. Philomath Community Services holds a food bank and a gleaner program. The Coastal Range Food Bank serves Blodgett and some of the surrounding areas, and kind of the gaps in between both Blodgett and Philomath. We kind of share those areas. I believe the Adair Community Church is a newer food bank up in that area, unless I'm mistaken, Julie, but correct me if I am wrong. And so that's giving us some assistance on the north side of the county that's new and much needed. Jenny's Place Food Bank out in LC works also with the LC Valley Gleaners in that area, and they are they're pretty established out there. They've got a nice place, and they work hand in hand, like I said, with the Gleaner program. Monroe also, what's not showing up on here is that Monroe has both a food bank and a gleaner program, which has recently, I don't think they've merged their 501c3s officially, but they're working as kind of the food bank locally there with both programs, with goals, if I understand correctly, to move into what we're calling the South Benton Resource Center. That's an amazing program down there too, and that outreaches into those areas of Benton County and even into Lane County somewhat in the Junction City area, some of the very remote areas of that part of our county. Transitional housing, the only formalized transitional housing we were able to locate was Harriet's Houses or Housing, which is out of Philomath, and they are small individual units that often share bathroom and kitchen facilities, but they're attainable. They're good entry level, and there are many, many, many people that have used them and been able to get more stabilized and moved on to other housing options. So it's an excellent model, and it provides a lot of support in Philomath, but we were unable to find anything quite like that for transitional housing in other rural areas. Permanent supportive housing, as you can see, is virtually blank. And of course, that's a long-range goal for this board to address on how we talk about that in high population areas, but also in our rural areas where there is a need as well. Homeless prevention, this is happening really indirectly by the services that are offered through like the Philomath Gleaners and Food Bank, Philomath Community Services, Strengthening Rural Families. If you go back to the maps and your own information there, you'll see that there are several locations that they support. So they're peripheral supports. Monroe, you'll see the Gleaner and Food Bank programs again and again, Strengthening Rural Families, and a repeat again in LC. But really, I'll speak as the program manager of Philomath Community Gleaners. We have limited capacity to do our program and work with that homeless prevention focus also. So I fully support, and I think so does a lot of the data, that we look at a resource center that helps navigate people when we know there's a need.
Catherine, I'm going to chime in here because Peggy has said a couple things in the chat, and so has Zan. Peggy, the initial goal, especially with that map, was to look at where there are physical locations where someone could walk in rural Benton County. So where could someone physically go in and say, I need help, please help me. But now I'm seeing you chat to everyone, Peggy, that CSC conducts remote satellite location access to services on a variety of dates in all of these locations. Can you share more about that with us? Because I didn't know that.
Sure. So what happens when people call our office for services, particularly during the heating season and they need utility assistance, what we do is we'll say, well, listen, oh, you're from such and such an area. Well, you can make an appointment to come into our office in, Albany, Corvallis, whatever it is that they're planning on doing. Or we're going to be out in your community at this location on such and such a date. Would you like an appointment to meet with us there? And we do things like, libraries, churches, food banks, a variety of places. We have a whole series of places that we have just like a rotation set up, and we're there every, multiple times during the year, every year.
Thanks, Peggy. That's great news. I'm guessing during COVID times that has had to be put on pause.
Yes, we are not seeing clients in person during COVID times.
Once you are seeing them in person again, please share those planned locations so that we can make sure to publicize them more, because that's an incredible asset. And then Zan was chatting, what about Monroe's Gleaners and Food Bank? And I inadvertently put it under homeless prevention before I added the column for food bank. So down in Monroe, the Gleaners and the Food Bank should be there in that empty square under food bank in Monroe. So Zan, thank you for catching that. I'll be sure to update that before I post this. And I believe, yes, so this is the synopsis of what Catherine just went over. Catherine, do you want to describe this?
So when you take a look at this, we're looking at basically the case management, comprehensive care coordination. So what we have and what we don't have is what we're covering here. As you see, the gaps across that first section of blue rectangles is pretty significant, and I see none in every one of those squares outside of Corvallis for most of them, except when you get, actually I see none. We're severely under supported, under resourced. It's just not out there, and I know from experience in our program, I have nowhere to send folks unless they can get to Corvallis. We just don't see that, and I hear that reflected also in other people's, the folks that are running the food bank gleaner programs and such. So efforts are continuing in. Am I still okay to hear? Because it's actually raining really loud here in my car.
Yes, we can
We're
hear
good?
you, Catherine, but we are about out of time.
Okay.
So
We're good. So we'll let you review this slide on your own, but in essence, this is a summary of how under supported we are in rural Benton County. And I'll just leave it at that.
Thank you, Catherine. Yeah, you went over all of this. This is more of just a visual summary so everybody can see across our spectrum the gaps.
Julie, if I just might
Sure.
add just one more thing for this group, it seems very important despite the rain. This is a side note, the Census Bureau will be doing the homeless population count tonight. Many of you know this already, but at least have it on everybody's radar, and we'll leave it at that.
Thank you for the update, Catherine. There was a question from Jim, and Anita, maybe you can answer it. Does Samaritan Health Services mobile clinic visit rural Benton County?
Not yet, but it's in the works. We're Corvallis, and we are going to be at Signs of Victory and working on the drop-in center, and of course we're at the men's winter shelter, but we are in conversation about outreach to all rural communities, and I think it'll happen in the next year is my prediction on that one.
Okay, thanks, Anita. So I just wanted to reiterate in the whole board's mind as we go into October what the model systems work group conclusions were about what is recommended to align these crisis response resources, to improve our coordinated entry and care coordination with some successful models, and to increase our units of permanent supportive housing. And then Alita, I'm going to go ahead and let you read this out loud. The group wanted to conclude with a little poem.
We felt that we've seen a lot of slides, but that we wanted to touch the heart a little bit. So this picture was found by Lennox, and I think we all thought it was a very good one. She can explain a little bit more about why she chose it, but we don't have too much time. But so Lennox, I'm just going to go ahead and read the what is called a pontoon, and it just takes 6 sentences. You put them together in a certain order, and when you read it out loud, it turns out pretty cool. So when you think about who we are, we're hope. So hope, hard work. Now we are here. Let's fill the gaps. Hard work, we can do better. Let's fill the gaps, no one left behind. We can do better, hard work, no one left behind, hope. Thank you.
Thank you, Alita. We have our last half hour dedicated to our equity consultant, and I'm going to stop sharing so that you can all see her and she can see you.
Hello.
Hi, Dr. Aguilar, how are you?
I'm doing great. Thank you so much for having me, and it's been an impressive presentation, and so it was good to get a scope of the kind of work that you're doing, and it's really so valuable to be able to pull the threads together of all of the different resources that exist in your community. So I'm grateful to be able to spend time with you, and I think that last poem really spoke to what we're trying to do here too, which is fill a different sort of set of gaps in our understanding and knowledge around equity issues, understand how our own lack of knowledge in those areas might be allowing some gaps to emerge in the work that we're doing. And so I'm really impressed with your committee's decision to try and address some of those gaps. And I'm hopeful that I can be really helpful in helping you think through some of the areas where you're doing really well and areas where you might need some improvement. So thank you I guess I should say a little bit more about myself before I jump into the assessment piece. In the slide that just was up briefly, it says that I am the VP for Equity, Diversity, and Inclusion at Willamette University. I've been at Willamette for 12 years. I started there as a sociology professor and continued in that realm for 9 years. So I have a long and broad kind of background in the scholarship of sociology. And then when Willamette was looking for to finally get a chief diversity officer, they looked internally first, and I was grateful to be able to be their VP for Equity, Diversity, and Inclusion for the last 3 years, and it's been a really wonderful chapter of my career. And then now you're actually catching me right in between jobs. I heard George mention Echo Northwest as doing some work for his organization in the past around, I guess, units of housing needs. And so it's an economic consulting firm, and they too are trying to really deepen their attention to equity in their research practice. And so they've hired me to be their director of research equity. So it's a big transition for me in terms of the kind of work, but it also has a lot of common threads in regards to really thinking through, how do sociological thinking and research equity intersect in ways that help us better serve our communities. So that's that. And yeah, I guess, should I just launch into the assessment?
I think if you can give me 5 minutes at the end, so only take the next 20 minutes, and then give the public a little background on what this assessment tool was before you go into the results, I'll start the slide.
Okay. Yeah, so Julie and I had some conversations around assessments, and I think there's kind of 2 different styles of assessment. I'm sure there's more than that, but the 2 that we thought about were a lot of organizations do some assessments on their practices, their policies. Are we thinking about how our organization best serves our clients and even in our internal staff folks? But because all of you come from different organizations, we agreed that it might be best to do an individual level and not a systems level piece first, and really allow folks to dig into their own place and their own knowledge and their own skill sets around cultural competence and diversity and equity issues. So each of the committee members was given an assessment, and I encourage you that I think the biggest benefit of this assessment has multiple benefits, but the biggest benefit should just be for yourself when you take it. You know, just going through the questions, thinking about, you know, how you might answer. If something strikes you as like, oh, I hadn't ever thought about that, you know, thinking about that question more. You know, there's others in which people felt really confident in their knowledge. So knowing where you are is really the number one tool or the number one goal of this tool. And so I say that to encourage those of you who didn't have time to take it, to just, even though it won't fit into the sort of larger matrix piece of it now, since I've already done the analysis, it's still really a valuable tool for yourself. So I encourage you to do that. The other piece that's helpful, and what I'm using it for in this case, is to think about holistically as a committee, where are some areas where we saw, you know, some strengths across the membership, and areas where we saw, you know, this is one where we ranked ourselves pretty low, where we might need extra support or some training, some additional thinking and discussion around that area. So that's how I've worked out the kind of scorekeeping piece of it, is really looking at where folks said, you know, this isn't something I feel super strong in, and here's areas where I do feel strong in. So that's how I've approached this individual level one. And in future meetings, I think we are going to do more of an organizational structure one, and ask folks to really think about their workplace and the place where they, you know, or whatever you call, whatever you're representing on this committee, and thinking about how to move, how your organization is participating and contributing to the larger equity structure. And I am not monitoring the chat, but I'm assuming, Julie, that if people are chatting things, you're going to jump in.
Yes, if people have questions or want clarification, please chat it. Or board members, if you see a pause and you have a question, go ahead and unmute yourself and ask it.
Yeah. Okay, so the assessment was divided up into 3 components, and the first one was awareness. And it was basically just kind of, you know, folks' self-awareness around these issues. So the lowest scores are the areas where folks felt least competent, and the highest scores are where they felt most competent. So I'm starting with areas where we might think about doing some additional considerations and thinking. So the lowest scores, the first one, I'm not quite sure. It says, I'm aware of my discomfort when I engage with others with a race, religion, sexual orientation, language, or ethnicity that's different from my own. This one, I'm not sure if folks were either they didn't have discomfort, so that wasn't an issue, or they just weren't aware of it. So I'm not really sure what to make of that one. I think the other ones are a little bit clearer. I do think that there are times where some of the lowest is also the highest in other sections. So I think that's worth considering. But, you know, here we had a low score of, I'm aware of my stereotypes as they arise and have developed personal strategies for reducing the harm that they cause. And I think this is one, because it is a low score and because this is such an important piece of the work that we all do, that it really is something that we should consider, you know, thinking about not only how, yep. Julie?
Peggy has a question when you have finished your thought.
Okay. Yeah, just thinking about how, you know, to recognize our stereotypes, and then also what do we do about that? I think, you know, there's the 2-prong approach of how do we retrain our thinking, as well as how do we create some structures that allow us to recognize that we probably will always have some stereotypes and biases, but we can create systems that help us mitigate them. Peggy?
Yeah, I think that this is one where I struggled, and that's similar to some others. And I kind of tongue-in-cheek said to Julie, we should have had one choice that was saying, I try really hard.
Yeah.
And because I think that, you know, you can only be as aware as you can be. You don't know what you don't know.
Right.
So, you know, some of these, it was a little hard to know exactly how to answer.
Yeah, and I don't think these are actually quite measurable things. You know, and this last question, you know, maybe you're aware of your stereotypes, but you don't have the personal strategies yet. So I think, you know, it's like, it's a double-barreled question. So it's not perfect, but I do think it big picture, it did allow us some things. allow us to see some things. Where people felt like they did have a lot of skills already was, seeing human differences as positive, clear sense of their own ethnic, cultural, and racial identity, awareness of how cultural perspectives influence judgment about what are appropriate, normal, or superior behaviors, values, and communication styles. What I find later in the skill set is that people actually don't have a very clear sense of their personal ethnic, cultural, and racial identity. So their family history, those kinds of things came in really low. But if you're part of a dominant culture, you probably rank this one high because that dominant culture is what gets taught in the school system. That sort of broad level history is what gets, put up as just regular history, right? And so I think that's where the distinction comes in, if I could guess and unpack it in that way. The other part that I'm really grateful for is the part about where cultural perspectives influencing my judgment. I think one of the most important tools that we have is to really recognize that dominant culture, so in this case, white, middle class, often male, straight, kind of that dominant groups are what actually set the yardstick for success in our culture, or for professionalism in our culture, or all of those ways in which, for what values should be our cultural values. So that's the yardstick by which we measure everyone else. And so I think by not recognizing that, we end up doing a disservice to ourselves and others. So I'm really grateful to see that this group has realized that that is happening and is trying to be more aware of that. I'm going to move through very quickly. Okay. This one, knowledge, again, the parts where I mentioned this before, folks had the lowest scores is knowing the specifics around historical experiences of non-European Americans in Oregon. And I think that is something that Julie and I already talked about, and maybe this group has discussed, about really wanting to know more about that specific history. And it's really important as you think about all of the structures that support inclusive housing opportunities for the folks in your area. And then people also didn't feel very strongly about knowing their own family story of immigration or assimilation. And one area where there was also low scores was intercultural and intracultural differences. I acknowledge both intercultural and intercultural differences. So we can talk more about those things. What people did have a lot of knowledge in was learning from their mistakes, knowing the limits of their knowledge. And again, acknowledging the importance of difference. I found a big willingness, and maybe speaking to Peggy's comment of, I'm trying really hard and I know this is important. And so that's a great place to be and start. I think the parts where folks didn't have as much, didn't feel as confident is in the skills. For instance, when we get to the skills section, that part in general, the whole section was rated much lower than the other two sections. So folks might know that they shouldn't, be colorblind, or that that they don't claim to be colorblind, but they don't quite have the tools yet to be able to intervene, for instance, if someone else uses colorblind language. And so I think that's the leap that we're going to try and make as a committee, is moving from good intentions and knowing that this is the right thing to, okay, now what do we actually do, right? Other high scores, understanding the influence culture can have and that cultures change over time. Folks are committed to lifelong learning. That's great. Recognizing that cultural competence involves a commitment to a continuation of education. And this is a really important one. Folks understand the impact that racism, sexism, and homophobia have, and the impacts that having stereotyped attitudes towards groups of people can have. So I think that's a really positive thing. Okay, like I said, the skill section overall had the lowest scores, which I think is great, right? I think having the knowledge and the awareness of the importance actually leads us to the place where we can develop skills. We know that skills are something that we gain through practice and through education. So the areas where folks rated themselves lowest is in the bystander intervention piece. So how to effectively intervene when others, when you observe others saying or doing racist and behaving in discriminatory ways. Folks also didn't feel like they had the tools necessarily to seek out situations to expand their skills, or to know how to get engaged involved in initiatives that promote understanding of diverse groups. and then recognizing their own cultural biases, which is interesting because I feel like earlier we had seen this as a high score. I know and use a variety of relationship building skills to create connections with people who are different from me. And then areas where folks feel like they do have good skills is acting respectfully in cross-cultural situations. And then awareness of within group differences, which to me is an interesting one because earlier it was saying like there was some confusion around intercultural and intracultural. And here, you know, it seems to be that people really understand that like, just because you know a few folks within a culture, that individual does not nearly represent the wide breadth of, you know, difference within cultural groups as well. Okay, so yes, I moved through quickly there, but I do feel, you know, really excited about the way folks were very honest about where their skills were and what their commitments are. And I think that overall, the scores were quite high. You know, there were almost no ones and very few twos. So people were really in the 3s and 4s range. I think I would love it if you kept a copy of your assessment and, you know, let's use it as a baseline where we can revisit, see, you know, how have things changed for you? What came up and how would you rate yourself differently now? And I think in some ways we think we're doing well. And I'll say this because I think one of the struggles that I tend to have with groups of people, especially that are doing really good work in their community, is that they end up saying like, we're trying and we're doing the best we can and we're on the right side. And so, you know, we don't have more work to do. Like we're already the good ones. And I want to say, yes, you are. Like this is the group that is like, you know, a student, but also we all have work to do and we all have more growth to have. And so I encourage us to not be complacent and say like, you know, man, at least I'm not like those folks who are doing really terrible and racist things. That because we live in a culture that has racist structures built into it, we are complicit in our participation in that. And that's not to shame anyone or to make people feel like, you know, that they're terrible, but that we do need to keep our eyes open and be aware of the systems and structures that, because we just navigate through the world without, you know, really stopping and looking deeply, we tend to, you know, not notice them. So I'll stop there because I have 5 minutes for folks to comment or ask questions about their experience taking the assessment or any other things you'd like to know.
Jade, before you do questions, I just want to clarify one thing for the board about your role. Jade is going to be attending the work group meetings next month to do more small group work, equity work with us. And then also the results of this survey she's going to use to create sort of a scaffolding training and education for this board. So that's why they were so important. Okay, I'll open up for questions.
So I had a question. Two things. I was a little surprised about the low part in understanding our state's history about redlining, and I thought that was pretty obvious if you lived in Oregon that we're a racist state, but okay. But I wonder if part of the reason we might be more confident about being higher is the current situation. We've really been exposed to a lot of Black Lives Matter issues, and I think a lot of us are really looking at ourselves differently. And so maybe if we had taken this survey last year, we wouldn't have done so well. But because we're really examining, you know, the racial, institutional racism and systemic racism, and pretty much agreeing that it exists and understanding what those terms are. So I think it'll be interesting if we can dig a little deeper. You know, we have a pretty good superficial knowledge, but if through this process we dig a little deeper and go, well, you know, what does that really mean?
Right.
So, but I appreciate your doing this, and you too, Julie.
An observation, and maybe it's a question, but I know I scored myself lowest in the skills area, not because I don't try, but because I I'm aware that I spend, almost all my time in one of the least diverse communities in the state, and in a state that is is not as diverse as many other parts of the country, and a state with a very racist past, and a lot of racist currently things happening. And but the point is that it takes practice to develop skills. It takes willingness, and I think going forward, because of where we live, the opportunities don't kind of come our way accidentally. We have to be intentional, and as a committee, we have to be intentional about building skills. We just can't count on happenstance to do it for us all the time. We have to expand our circles. And so you don't even have to comment about that. It's not really a question at this point, but it seems like it has to be part of our work plan.
Thank you.
Are there any other questions for Dr. Aguilar or about her role going forward?
I just want to say that I'm excited about it, and I'm very much looking forward to learning more about how we can work to address the needs of the folks that we've identified that are disproportionate populations in our homeless communities here, and how to do it sensitively, and how to ask questions the right way so that we get the information we need to do it.
Mm-hmm.
Yeah, and part of what Dr. Aguilar and I have talked about is how to include local pillars in our community who are experts in their field on the racial history of Oregon from a Black perspective and from an Indigenous perspective, because we have lots of people here who are doing great work to have conversations and educate our own community. And how do we include them in Dr. Aguilar's educational strategy for this board? So that's something that we'll discuss as well.
Isn't that also tricky? When I was at OSU, I chaired 3 minority affairs task force. And every 3 years, the university decides it wants to, deal with itself, and they have boxes of them. But what I experienced was the groups that we were talking with were so tired of having to talk to us and solve our problems. They said, we're really tired of you white people coming here and saying, how can we help you, or what can, tell us about X, tell us about Y. I said, just go out and learn it on your own. And so I think we want to be sensitive to overburdening the people we have in our community who are so involved in this, to have them come in and solve our issue. And there's a lot of stuff out there we can read and learn on our own too. So I just want to make us aware that we want to be careful. And I'm sure you all are, but it was my experience, and I thought, whoa, this is something I need to remember.
Yeah, no, you're right, Carol. And I approached it when talking with Angel Harris and Lou White Bear the same way of, we need to do our own work. We want to hire an equity consultant. We want to pay for that work. How do we also be inclusive? And both of those women said, we would like to have community listening sessions with you. We want to be involved.
Great.
This is part of our role. This is part of our job, and something we want to be invited to. So making sure to understand the difference in asking anybody else to do the work versus us doing it as well.
Excellent, excellent.
Yeah. Well, thank you, Dr. Aguilar. I'm going to explain your role going into next month. Give me just a second here to start this and make it bigger. Okay, so where are we? We just finished our September meeting, and going into October, your 3 work groups are going to meet separately, and the first half hour of that work group, Dr. Aguilar is going to attend. And she and I are going to meet separately to talk about the kind of work that we'll do in that half hour in the smaller groups. And then she also is going to stay for the second part of that meeting, where the work groups discuss what kind of discussions would be helpful to bring back to the full board to prioritize. And Dr. Aguilar is going to play the role of an equity advocate and an equity lens to ask us questions, to talk about how we are discussing these topics, with the ultimate goal to be to teach us all how to serve as, Jim, what did you call it when you were on that, on the interviewing committee? Equity advocate?
Jade knows the term.
Yeah, I think that that is where we landed, because it's modeled after something used for search committees, but that's a search advocate. So I think the equity advocate was right.
Yeah, and looking to the possibility of having each board member play the role of the equity advocate at each board meeting going forward. And what does that mean? What kind of questions do you ask the group? What kind of lens do we look through different issues? And so Dr. Aguilar is going to model some of that behavior in your work group meetings. And then the ultimate goal is at the October full board meeting next month, for this board to decide on your 3 to 4 priority areas. And so each work group is going to come with some research to lend to the conversation and the discussion about what data points to as far as priority areas, what a model system points to, and what our current system and the gaps point to for 3 to 4 priority areas. And you all will hopefully decide at next month's meeting. And then this group will break into 3 to 4 work groups based on those topic areas. And in November and December, we will engage the community on those topics to get feedback.
So Julie?
Yeah. Let me stop screen sharing here.
Are we going to deal with or talk about or include in this conversation disabilities, people with disabilities? We tend to talk about, when we talk about equity, we tend to focus on racial issues. You know, we're talking, and right now you're talking about, we'll get the 2 people you mentioned, or, you know, those are great, but it seems like the people that always get left off are those with disabilities, and how they get, how we talked about people with disabilities and advocate for them, and especially because we're talking about housing and vouchers and things like that. So I hope somehow that gets into our mix.
Yeah, I'm glad you mentioned it. I mean, one of the parts of the definition of vulnerable populations are individuals with a disability. And I have separately attended MADAC, the Mental Health, Zan, what does the acronym stand
Mental
for?
Health and Developmental Diversity Advisory Committee, which also represents, it's a mouthful.
And I have connected with some fantastic developmental diversity advocates outside of that meeting to make sure that that group is included as part of the community engagement. Because some of the feedback that their subject matter experts had was, you know, how are we defining disability? And the response was, it's defined differently at lots of different providers. Some include substance use disorder, some include mental health, some don't. And so including that group in our community outreach and engagement, and getting their input on how else to cast the net widely, so that that viewpoint is included. And as with respect to the 2 local experts on the racial history of Oregon, it was really only in the context of that topic. So.
Great.
Okay, we are almost out of time. You guys did incredible today to give so much information in a very short amount of time. But any questions about where we are in the process, or what our goals are for this next month, or how you are feeling about any of this?
I thought this was a great presentation. I learned a lot from you know, we've been focusing on the ideal. So I thought the presentations today were most excellent.
I agree.
I would say that we've come a long way from the day that we sat in the gym at the Methodist Church and tried to put together what we knew, and we had so many holes in our knowledge. And I think that the fact that we did have extra time because of COVID, in some ways, was to our advantage. We've learned a lot.
Yes, and part of the burgeoning role I would like to play at the county is to put together a 1-hour training for all new county hires that could be used by other organizations to go through pretty much what was gone through today. What do we have here? What are our resources? Where do people go? What's available? Where is it located? What do they do? What populations? Because it has taken me this long, being hired almost a year ago, to understand everything that we have here in the community. And so my county management has fully supported me putting together that kind of training and being able to share it. Yes, I agree, Peggy. That would be great. So in my free time, that is one of my goals that I hope to effectuate by early next year, putting together an hour training so that everybody can benefit from this. New hires at the county and the city, wherever, CSC, you're welcome to it. Well, thanks you all. You did a great amount of work today. Dr. Aguilar, we're happy to have you here. Many of the chats are saying what a great presentation. Great job, everyone. And Dr. Aguilar, welcome. All right. Thank you all. And we'll be hearing from each other in October. Carol, was there one more thing you wanted to say?
Nope. My
Okay.
lips are sealed.
Take care, everyone.
Bye-bye.
Thank you all. Goodbye.
Thank you.
Bye-bye.